Have you ever gotten a blood test result back, glanced at it, seen the letters WBC, and just kind of nodded along, not really sure what you were looking at? Yeah, you're definitely not alone. Those three little letters stand for white blood cells, or leukocytes, and they are pretty much the unsung heroes of your immune system. So in this explainer, we're going to decode that number and really uncover the crucial story it tells about your health.
So here's what we're going to cover. First, we'll meet the troops, your body's defense army. Then we'll get into how to decode the numbers on your blood count. We'll look at what it means when that army is weak and what it means when it's overactive. And finally, we'll tie it all together and see why this stuff really, really matters for your long-term health.
All right, first up, let's get to know the basics. I mean, who are these cells and what exactly is their job? This is really the foundation for understanding your immune system's first responders.
Okay, so think of leukocytes as your body's own personal, highly trained security force. Their number one job is to protect you from invaders, things like bacteria and viruses, and to clean up any damaged tissue. You know when you get a cut and sometimes you see pus forming? Well, you're actually looking at a massive pileup of these heroic cells that have literally died in the line of duty fighting off those germs. Now, this security force isn't just one big mob. Nope, it's actually made of several specialized units. And while they're all important, the vast majority, we're talking like 90% of your white blood cells, are either neutrophils or lymphocytes. So we're going to focus on those two big players.
Let's start with neutrophils. These are the frontline infantry. They are by far the most common type of white blood cell and are the first to arrive on the scene of an infection. Their specialty? Taking on bacterial and fungal invaders. They're what we call phagocytes, which means they literally eat the enemy cells to neutralize them. Pretty cool, right? So if neutrophils are the infantry, then lymphocytes are your special ops and intelligence unit. These guys are crucial for your adaptive immune system. That's the part that actually remembers past infections. This group includes your T cells, which fight viruses directly, and B cells, which are responsible for creating the antibodies that give you long-term immunity. Okay, so now that we know who the players are, let's figure out how this all translates to that number on your lab report. What is a normal count, and what do all the different numbers actually mean?
For most healthy adults, a normal total white blood cell count is somewhere between 4,000 and 11,000 cells per microliter of blood. But, and this is super important, normal isn't just one single number. It can change a lot depending on a whole bunch of factors, especially your age.
Just take a look at this table. It's kind of wild. A newborn's count can be over 30,000, which would be a massive red flag in an adult. Even a toddler's normal range is way higher than a teenager's. This just goes to show you that context is everything. These numbers are a guide, for sure, but only a healthcare professional can truly interpret your specific results. Now, when your white blood cell count falls outside the normal range for you, it generally points to one of two conditions. On one side, you've got leukopenia. That just means your count is too low and your immune defenses are down. On the other side, you have leukocytosis, where your count is too high, signaling that your immune system has been kicked into high gear. Let's break both of those down. So, we'll start with leukopenia. What happens when your body's defense army is understaffed, and what are some of the potential causes?
One of the trickiest things about leukopenia is that a lot of the time, there are no symptoms at all. You might not feel any different. But if your count drops really low, your body basically loses its ability to fight off germs. And that's when you might start seeing signs of an active infection, like a high fever, chills, or some heavy-duty sweating.
So what causes this drop? Well, there are a few big reasons. It could be conditions that affect your bone marrow, which is where these cells are made, things like aplastic anemia or autoimmune disorders like lupus. Certain infections like HIV can also be a cause. And of course, cancer treatments like chemo and radiation are literally designed to kill fast-growing cells, which unfortunately includes those vital cells in our bone marrow. And it goes beyond just those major medical conditions. A surprising number of common medications can be a factor too. And crucially, so can what we eat, or maybe what we don't eat. Deficiencies in key nutrients like B12, folate, copper, and zinc can directly mess with your body's ability to produce these vital immune cells. All right, let's flip the script and talk about the opposite condition, leukocytosis. This is what's happening when your lab report shows a high white blood cell count. It means your immune army is on high alert and right in the middle of a major response. Now, the very first thing to know is that a high WBC count is not automatically a bad thing. Sometimes it's a completely normal, temporary response. An intense workout, going through some major emotional stress, even pregnancy, all of those can cause a temporary spike. It's just your body mobilizing its resources.
But a persistently high count, what we call pathological leukocytosis, that often points to an underlying problem. It's frequently the very first clue your doctor gets that your body is actively fighting something. The most common culprits are bacterial or viral infections, but it can also be a sign of chronic inflammation from conditions like rheumatoid arthritis, severe tissue damage, or in some cases, blood cancers like leukemia.
So, we've talked about infections and all these specific conditions, but why does keeping an eye on your leukocyte count really matter for your long-term overall health? Let's zoom out and look at the bigger picture.
Because it turns out the story of your white blood cells goes way beyond just fighting off the common cold. There is a powerful and honestly pretty surprising link between your white blood cell count and your cardiovascular health.
Just listen to this quote from a 2017 review. A high white blood cell count is an independent risk factor for heart disease, on par with things like high cholesterol and smoking. The reason is that a constantly high WBC count is a huge signal of chronic inflammation. And we now know that inflammation is a key driver of atherosclerosis, the hardening of the arteries. So what's the big takeaway here? Your lab report isn't some grade for your health. It's a tool. Understanding that WBC number is empowering. It helps you ask smarter questions and have way more productive conversations with your doctor, not just about infections, but about managing chronic inflammation and protecting your health for the long haul.
And this really brings us to one final thought. When you consider everything from nutrition to stress, what can we all do in our daily lives to make sure this incredible defense army has all the resources it needs to protect us? It's a question that's definitely worth asking.